Good morning, everyone, and thank you for joining us today. Today, our speakers are Holly Choi, the Vice President, and Katherine Hutka, President of the Canadian Passenger Safety Association of Canada. Katherine Hutka is a health promotion specialist for Child Safety Link, a children's injury prevention center based out of the IWK Health Centre, a regional children's hospital located in Halifax, Nova Scotia. Katherine is a CPSC instructor and an instructor of safe travel for all children, a specialized child passenger safety course to safely transport children with unique healthcare needs. Holly Choi is a baby and toddler safety educator based in North Vancouver, British Columbia. As the co-owner of Safe Beginnings First Aid, Holly educates parents and caregivers on essential baby and toddler safety and life-saving skills through local workshops and across her social media audience. Holly is a Canadian Red Cross First Aid instructor, a child passenger safety technician instructor with CPSAC, and an active member of the International Association for Child Safety. Today, we are going to learn about the landscape of child passenger safety in Canada. Katherine and Holly will discuss the unique barriers Canada faces in regards to child passenger safety and the education and advocacy work that CPSAC does to break these barriers down. If you have any questions during the presentation, please enter them into the chat box at the bottom of your screen. After the presentation, you may unmute your audio line to ask questions, or I will ask the questions on your behalf. And Holly and Katherine, I'll pass it over to you for the presentation.
All right, thanks so much, Anita. All right, so I think I'm going to get started. And Holly's switching the slides, so we'll have a little bit of communication there. Throughout the presentation, Holly and I are going to go back and forth as well. So today we're going to go fairly quickly just because we have a lot to cover, but we're so grateful for the opportunity to present to everyone here. I wasn't sure what I was expecting for participants, but I've seen a lot of familiar names there. So hi, everyone that we already know, and nice to meet everyone that we haven't yet met. So our learning objectives for this session, we're just going to talk about the unique barriers to child passenger safety education in Canada and how CPSAC, CPSAC, the Child Passenger Safety Association of Canada, meets those needs. We're going to also learn about some challenges, the partnerships that have made this work possible, the opportunities and plans for expansion for the future. So today we're going to go over just a brief overview of the issue for those who might be new to addressing this issue in Canada. We're going to talk about the unique challenges that are faced in Canada specifically compared to other places. We're going to talk a little bit about CPSAC, that's how we pronounce it, our members, partnerships, advocacy, and opportunities for expansion for the future. All right. So let's begin here. We're talking about children's injury prevention. Why is this important? Why is this the work that we focused on? And so we know that in Canada, on average, 73 children aged 1 to 14 are fatally injured each year in Canada because of a motor vehicle crash. We also know that in Canada, collisions are a leading cause of fatal injury for children aged 1 to 14. We also, you want to go back just one? Sorry. We also know that some crashes are not survivable, but many are, and that when child passengers are correctly buckled, the risk of death or injury is reduced. If you want to go to the next slide. So we've added a car seat into the little graphic here, so we know that a properly used car seat can reduce the risk of a fatal injury by up to 71%. So car seats save lives. So we took a look. These are stats from the vehicle crashes and the fatalities, serious injuries, and those minor or more moderate injuries as well from 2019. So in that year, we saw that there were 67 serious injuries. So that's hospitalizations, more than just a cast and back out the door out of ER. And so when we were talking about that, we saw that we have another stat that says that 92% of infants and 74% of toddlers who suffered severe injuries, it determined that they were not restrained appropriately at the time of the collision. And for school-age children, that percentage was 96%. So of those children who were seriously injured, we have this analysis that 96% it would be estimated to be improperly buckled up or using the wrong seat or in some way not properly buckled in the car. So These stats come from a study that we did in Nova Scotia in 2012. It's been a little while, but we're looking to redo these stats. But here's what we saw. We took a look at about 1,200 children. These were vehicles that we're not expecting to be looked into that day. It was, a random study where we looked at urban and rural areas, and we found that at that time, 99% of the kids that we saw were buckled in some way. But of those kids, we saw that 73% of the car seats, so like a harnessed car seat, rear or forward facing, were installed or used incorrectly in a key way. And I will say, I was there on the ground doing the study. We were not reading manuals. We were not calling the companies. We were looking at the basics. Is this harness tight? Is the seat attached to the car? Is the child in the right seat for their age, weight, and height per the law at that moment in Nova Scotia? So we found that 73% were not using their car seat appropriately in a key way. We found that 30% of the children who were sitting on a booster seat or in a booster seat did not meet the weight minimum, which is the same across Canada, so that they did not yet meet 40 pounds and were not heavy enough to be in a booster seat at that time. And we found that 52% of the kids who were using a seatbelt alone did not safely fit the seat without a booster seat. And of those 52%, half of those were not legal to be in the seatbelt in Nova Scotia at that time. So we know that Canadian caregivers need additional support. Everyone loves their kids. They're all doing the best they can with the information they have, but they need our support. So we also know that car seats and booster seats can do their job when they are the right seat, they're installed correctly, and they're used correctly on every single ride. And so now Holly's going to talk to us a little bit about her story.
So I'm going to give you a bit of personal context because while data speaks, we also wanted to give you a story, my story, which I will just preface by saying nothing awful happens in this story in case anyone's worried about that. Just so you can understand really how prevalent this problem is. So back in 2015, I was pregnant and about to give birth to my first daughter, Sadie. And as part of that excitement, of course, we had a baby shower. I'd registered for all my baby gear, and I had selected my car seat based off of the color. I thought it was cute. I love teal, and I thought this is a great opportunity to get something beautiful for my daughter. Not realizing that there's probably a little bit more to car seat selection than color. My daughter was born, and there she is. And when she was born, we had the car seat installed in the vehicle. And our vehicle at the time was very small, and I had chosen unknowingly the second largest infant car seat on the market at the time. It didn't fit hardly at all. And so my solution was, why don't we just get a larger vehicle? And it still didn't fit. So here we were, and we were really having a hard time with this. And I didn't know of any resources to help me. Meanwhile, I was in the midst of a major career shift, and my sister and I were working towards expanding our child safety business out of just first aid. My sister and I had gone for a walk one day, and she said to me, Sadie really looks like she's not in her car seat correctly. And I said, well, what do you mean by that? And she said, I don't know, but it just does not look right to me. So in that moment, I started to think about it. And she said, we could take a course. Do you know there's a course? Why don't we take this course? So wasn't super interested in doing it, but she dragged me along, and I took the child passenger safety technician course through CPSAC. The course was multiple days, and on the first night of the course, I realized in that moment I had been doing everything with my car seat incorrectly. And I really was floored because I was confident, how hard could this be? Can't you just read the manual and follow the instructions? My husband and I had watched multiple videos on the internet. It just wasn't working out. And I realized that first night that if I could make that many mistakes, how many mistakes were people making? I locked myself in my vehicle after the class that night. I sobbed for 20 minutes, just thinking, wow, am I even qualified to have a child? I was 8 weeks postpartum. That probably had something to do with it. But at the same time, it was this understanding that this is the way that parents are feeling, and we need to offer some support. So through that course, I learned, one, that being a parent and a caregiver is really hard, but also that there is a huge amount of societal pressure for parents to be knowledgeable about everything related to their child's safety and well-being. On top of that, as Katherine said, we don't know what we don't know. We are doing the best with the information that we have, but if we don't know what we don't know, how are we supposed to access any support for that? And I also realized that with this new information, we have an opportunity to create some meaningful change. So I guiltily deleted many photos of Sadie in her car seat during that course, and I wish I hadn't. I missed this one. And I keep this photo to remind myself of the mistakes that I made. And just in case you're not highly familiar with car seat safety, just to point out a few things that were happening in this, I know, very dark photo. It's probably why I missed deleting it. The harness is not tight at all. The chest clip, which is really going to help retain her in the harness during a collision, it was way too low. The seat was installed correctly in almost any way I could have possibly installed it incorrectly. And again, not a great photo here, but real life, immediately after the course, she looked significantly better in her car seat. So what did I do with all of that training? So leaving the course, I was certified as a CPST, which allowed me to start volunteering in my community here in North Vancouver. I realized no one was really doing that in my community, and word got out, just word of mouth. I had people practically kicking down my door for help. I was helping probably about 3 or 4 days a week, and each day that I was volunteering, I was helping about 3 or 4 families. So in some cases, over 15 families a week were coming to see me for volunteer support. So in 2015, in October, I was certified as a CPST through that course. I started a website here locally in Vancouver called Safer Seats for parents to find help locally. In 2017, further down the rabbit hole, I became an instructor through CPSAC. So I took my certification to become an instructor and train new CPSTs myself. In February 2019, I joined the board of directors. I am now, as of February 22, the vice president, but in June 2019, with community support from a local electronic health record software company, we were able to expand the Safer Seats initiative across the Lower Mainland BC region. So our website is just a small little local branch of some of the amazing work that CPSAC does, but since we relaunched the website in 2019 and through just the end of January 2023, a few days ago, Safer Seats has booked over 3,244 appointments with caregivers across Lower Mainland BC. So here is just a few photos of my journey. You can see I was very pregnant when I became an instructor, but those are some of the wonderful technicians that I've trained myself personally in the last few years. All right, back to you, Katherine.
I wanted to mention too that Holly's number takes into account COVID. I know it was only from 2019, but what would that number have been, if more in-person support had been possible during those years? So
Absolutely.
Thanks for that, Holly. All right, so a little bit about child passenger safety in Canada. We want to keep going with the slides there. Yeah. So here are some challenges that we have, which is a lack of federal infrastructure, support, and funding creates additional barriers for the recognition of importance of child passenger safety in Canada. Some of the partners and stakeholders and people who, are involved in this conversation in a lot of different ways. Federally, it'd be Transport Canada through the Canadian Motor Vehicle Safety Standards and other branches. Health Canada through the, primarily through the Consumer Product Safety Act, and the Public Health Agency of Canada. There's different roles that everyone's playing. Provincially, we have health authorities, including hospitals and primary health. We have law enforcement who are engaged in this work as well, as social service organizations, which include, in this category, we're including family resource centers and other community services, whatever that looks like. They all are named something different in every province. We also have caregivers, and that includes daycares, schools, and families who are looking for this information and support. So when we talk about Canada, I know we might be aware that there is, there's programs in the US that are a little bit more robust, but we wanted to look at how do we compare to what the US is doing. We've modeled a lot of the Child Passenger Safety Association of Canada off of, the US model, because there's been a lot of research and a lot of study on what they do, how they do it, and how they're supported. So we wanted to compare and just take a look. All right, so we've got Canada, which is roughly the population of California. And we took a look at a snapshot year. We took, this is 2019, because obviously 2020 was a weird year to choose. So in 2019, this was our population. The courses taught in Canada were 82. The courses that were taught in California were 55. New technicians trained across Canada were comparable, just a few more than California. The total technicians at that time, 2,423, and California had 2,500. So we were very comparable. The recertification rate is lower in Canada, but it's still 30% of the eligible people. And in California, it was 48% of the eligible people. But again, because it's so integrated into their government and into their society, people might need that certification to be able to do this work. Whereas in Canada, it's not as required. So many people are taking it for their own information and not following up, not becoming recertified, not staying connected. So there's a huge difference when we look at the comparison, and that is that our landmass is 25 times the landmass of California, meaning that our population is much more spread out. So we have a lot of rural communities that have little to no in-person support options. And we just wanted to highlight this. And we recognize that most people don't live kind of in where we've placed California there. Most people live across the bottom, but I do believe the bottom of Canada is still like 5 Californias if you spread them all out. So we have a massive landmass, and even though we have a comparable amount of people who've taken this training with us and are doing this work across the country, it's not enough. We need to expand. We need more, and we need to have other kinds of options that parents, families, and agencies can reach out to. So for access, it is our goal that caregivers would have access to child passenger safety supports regardless of geographical region, and that includes rural or urban, regardless of language. We're hopeful to be able to reach people with different literacy and language concerns, who may have different levels of literacy. We want to make sure that our resources, the work that we do, and the people that we train, have a cultural safety lens in the work that they do as well. So we want to make sure that there is a cultural safety to the work that they're doing, and we want to make sure that we reach caregivers regardless of socioeconomic status. So here is a little bit about CPSAC. Is this you or is this me still, Holly?
This is you.
Okay, I will keep going then. All right, so the Child Passenger Safety Association, or CPSAC, is a national nonprofit organization that primarily provides child passenger safety technician training and certification. That's the main thing that we do. It's led by an elected board of directors and supported by committees, all of whom work as volunteers. Some of the origin stories. It was formed in 2011 by a group of passionate child passenger safety advocates from across Canada with the goal of creating a national unified child passenger safety training program. It was initially funded through a grant from Transport Canada. The National Road Safety Research and Outreach Program was the name of that grant. Today, CPSAC is self-funded by members, powered by volunteers, and has brought together many of the varying CPS programs in different pockets of Canada to create a national unified program. So we did celebrate our 10-year anniversary last year. Okay, is this you now, Holly?
I take over at education.
Gotcha. Okay, so safety is our middle name. The Child Passenger Safety Association of Canada's mission is to provide Canadians with the skills and knowledge to safely transport children and to be the Canadian leader in child passenger safety through education and advocacy. So we're going to start with education.
Perfect. Thank you, Katherine. So I'm going to talk about a few of the programs that we offer to Canadians. First, and if you were present at the Canadian Injury Prevention Conference in November, we spoke about our online workshop, specifically our Child Passenger Safety for Drivers workshop, which is for caregivers that transport children. This could be through social services, this could be through a family resource center of some sort. There are lots of applications for that particular online program. We also adapted a version for retailers through a partnership, which we'll speak to a little bit more later, with Toys R Us and Babies R Us. So these are online programs that are designed to reach communities or organizations where they have difficulty with time zones or scheduling, and they still need that core child passenger safety education, but maybe don't need that full CPST certification training. This has really helped us fill a gap in those communities and organizations. Our core and what we mainly do through CPSAC is child passenger safety technician certification training. So our program is a nationally recognized training and certification program, and it is an evidence-based curriculum focused on best practice. If you're not familiar with the term best practice is what we know is going to protect children based on injury data and versus the legal minimums of what we are required to do under the law. Our training program, CPST certification specifically, is completed in person. It is a very hands-on, skills-based course. Lots of demonstrations, group activities, videos, and knowledge checks throughout. It's approximately 24 hours in length and delivered over 3 to 3.5 days. The certification and membership with CPSAC is therefore then successful completion, valid for 3 years. And again, we are seeing many of our members recertify, especially those that are very passionate about the work. So a little bit about our members. We're very, very proud of our members and all of the amazing work that they do across Canada. Currently, our network of certified CPSTs across Canada total over 1,300. And you can see that, like Katherine said, majority of us Canadians live along the parallel there, but we do have them spread a little bit more out, and a few up north as well. So what is a CPST at the end of the day? Child passenger safety technicians use their skills to help parents and caregivers learn about how to select, install, and properly use car seats and booster seats, which, coming back to my story from earlier, is if I had known that that was an option, it was definitely something I could have used when I was expecting my first daughter. CPSTs advocate for child passenger safety best practices. So again, these are evidence-based safety recommendations, not the legal minimums, and provide community outreach, support to organizations, and support directly to caregivers. So some ways that we do that as CPSTs, we support parents and families in a variety of ways. Some use their training through a prenatal or parent education avenue, workshops and classes, car seat check events or clinics, roadside check events, which Katherine alluded to earlier through that study she mentioned. So this is with law enforcement. These are unprompted seat checks, as well as offering direct one-on-one support in a private appointment, which is mostly how I use my own personally, or some people do this virtually. So some of our work can be done just by assisting caregivers over a video call, as shown here. So our members support caregivers in person across the provinces. So BC, Yukon, Alberta, Saskatchewan, Manitoba, Ontario, Quebec, Nova Scotia, PEI, New Brunswick, and Newfoundland have in-person support, but we do offer support nationwide and to those rural communities as well through virtual support. So who are our members? We have a huge variety of who is taking CPST training. So our members are represented in many roles across different fields, including healthcare. In healthcare, we often see maternity nurses is a huge one, law enforcement, social work and family services, childbirth support and education, retailers, government, safety advocates, and volunteers. We often see a lot of parents who are just really interested in receiving the knowledge, become passionate, and become a volunteer, which is really what happened to me. So when we say car seat check or car seat check event, many of our CPSTs across Canada assist caregivers one-on-one through something called a car seat check. And during a car seat check, the CPST will document how the seat arrived, provide education to the caregiver relevant to their child passengers, and then help the caregiver become confident installing that child restraint, so a car seat or booster seat, on their own. Our goal is really to teach them how to fish. We want to make sure that they are confident using the seat that they came in with and know the ins and outs of it in the event that they need to do it themselves again at another point. So this is really a unique opportunity for our members to work together to hear real concerns directly from caregivers transporting children and help those caregivers navigate those potential misconceptions or biases related to child passenger safety. Anytime you work in injury prevention, you know you're going to get a lot of biases coming up. A lot of survivorship bias specifically happens in child passenger safety. And there's nothing I love more than someone who's skeptical that wants to have a conversation. So this is actually a really fantastic opportunity to help break down some of those barriers. And we do that by supporting caregivers with empathy, with education, and empowerment. So Katherine's going to speak a little bit to our partnerships.
If you wanted to pop back just to that slide for 1 second,
Sure.
I had a thought. So sometimes there's a criticism about child passenger safety technician training that one of the criticisms is often like, we don't want to create a culture of experts. We want to empower, we want parents and families to know that they can do this themselves. And I just want to address that to say, like, that's absolutely a part of this. Like, we are empowering caregivers to be able to have the knowledge and skills to transport their own children. I think there's also a misconception that, like, car seat checks are something that people can purchase, that there's a business, and that is absolutely true, that there are doulas who are offering prenatal education, and a car seat check might be a part of that. But I will say that 50% of the child passenger safety technicians in Nova Scotia, I just had to pull these stats up for another organization, are trained through family resource centers who have a focus on vulnerable populations who live within their own communities. So the majority of people who are doing this work in Nova Scotia are, and in other pockets and places as well, just depending on who's identified this as a main concern, are helping parents and families who have low literacy, who may be newcomers from other countries that don't have seatbelt laws. That's a particularly vulnerable population when it comes to car seats, and also First Nations and Indigenous communities across Canada. But we have First Nations health centers, particularly throughout New Brunswick, PEI, and Nova Scotia, who do have child passenger safety technicians trained to address these needs within their own population. And so there are, these people are doing the work and, making sure that there is an equitable lens on how this is supported across Canada. So we have addressed kind of figuring that out, and it's not an expert culture. It's, I'm here, I know about this car seat, I'm going to help you read the book, and together we're going to make sure that you feel comfortable doing this, right? You've got this, is a message that's kind of throughout our training. So I just wanted to put that out there. I was having thoughts while Holly was talking. So with that, there are a number of partnerships that CPSAC has been able to forge over the years to further this work in different provinces and communities. So of course, our main partnership would be with Child Safety Link, which is through my organization. And we were partnered even before I was president of this organization. That's a long-standing partnership, and that's how we are able to provide to further this work, and also to provide technician training for Nova Scotia, New Brunswick, PEI, and sometimes Newfoundland when we can. We also have a partnership with the Saskatchewan Prevention Institute that we've had for a really long time, the last 4 years at least, and now kind of a newly formed reimagining of that relationship with Saskatchewan government insurance as well. We've had a longstanding partnership with Transport Services Branch, Department of Highways and Public Works, with the government of the Yukon. They have their own manual with all of their own logos and language throughout. And also a longstanding partnership with Toys R Us and Babies R Us Canada as well for technician training and for their own online on-demand retailer program for their staff and associates. Also, over the years, we've developed relationships with car seat manufacturers as well as other industry leaders, many of whom provide webinars and technical updates for members. I just grabbed this kind of as a screenshot to give like an idea of the kinds of companies that we have partnership. These ones are ones who donated something towards Child Passenger Safety Week that we gave out as prizes for members who reported their activities during that month. It's just a way to keep our members engaged and also for us to have like a snapshot of the work that is being done, that we have that kind of as a measurable month in the month of May, and then again in the month of September, where we take those snapshots of the activities that our members are doing. And so these are the organizations that did donate something as a prize. But we also have other industry leaders who do deliver webinars. We have a speaker series where we do webinars each month, and that would include Transport Canada has come to speak, and we've had Safe Ride News, the author of the Latch Manual, comes and does an update every year. I think she's speaking next month. And so we do have other partners as well who do present in those speaker series to keep our members up to date. Okay. And so advocacy, that was the other part of our vision, was to advocate for better child passenger safety, supports, laws, all those things kind of across Canada. And so the way we do our advocacy work, that might be, it's different every year. It's not ad hoc, but it's something that we're working towards, to doing better, to doing more advocacy. And so that has included in the past public consultation from provincial or federal governments. It's included position statements that have gone along with our contribution to public consultation. There is some direct advocacy as well, where we've reached out to organizations, companies, to provinces and territories to talk about different issues. And we have created tools for members to use to advocate locally as well. So we've created templates so that people are able to make a media release, about an event or about child passenger safety in general. We've, again, those position statements are also something that can be shared. And we also have advocated in response to calls. So like in response to calls for national input or provincial input on different subjects, well, the same subject, I should say, but in different areas, and at the request of members. So sometimes members call and say, like, I need someone to help me advocate for this in my local area. What do you suggest? Can you link me to resources? Can you link me to studies? Here I am, I'm starting out. How can you help me? And also we have advocated in response to trends. So I think there's a slide coming up about that. So I'll talk about that in a moment. So some of the calls for a public consultation have included, there was the Nova Scotia Traffic Safety Act was open for consultation. And so the Child Passenger Safety Association of Canada did submit consultation for that, did submit our recommendations, and also supported templates for our members to be able to participate individually. And also with the New Brunswick Motor Vehicle Act, we did the same thing. And then Transport Canada had an open consultation around the use of car seats on aircraft for children under 2, and we also contributed in that way at that time when asked. And so some direct advocacy. Over COVID, there was some issues where parents and caregivers were being asked to fully dress their child for hockey. I don't know how many hockey parents are out there, but it's a lot of gear that goes on. So hockey pants are definitely, thick, padded, and parents and caregivers had some concerns about how the car seat could be, or the seatbelt would safely fit on a child's body naturally in those circumstances. And so we did approach Hockey Canada. We worked collaboratively to produce joint messaging from Hockey Canada and CPSAC and MTO as well, so the Ministry of Transportation for Ontario, and it resulted in a social media infographic here that was shared, and also we supported the creation of social media infographics in those organizations as well. And we also created some resources for members to be able to advocate at the local level to say, well, actually Hockey Canada has changed their tune, here's what it looks like, and maybe the folks in your local area need to connect and kind of revisit that with Hockey Canada during that time. So in addition, we've also starting to create some more tools for member advocacy that includes shareable social media images. This isn't something that CPSAC's traditionally done. Traditionally, we've provided the training for people who then worked in organizations across Canada to produce their own graphics, their own images. We've referenced back to Parachute. We've referenced back to Child Safety Link and to other agencies who are creating resources for parents and caregivers. So this was the first time that we did create a parent-facing resource like this. We also do have templates so that our members can create their own graphics and communication around this as well, and to add some of their own logos. We talked about the media release and media advisory and press releases. And we also have networking supports. We do have a network where, you know, our members can communicate on our board on our website. There's a message board, and also in a direct way on Facebook, so that we can share information, we can problem solve, we can make a meeting, we can be invited to speak at a meeting. So we've provided those resources as well. All right, so what are some of our plans in the future? What are we looking forward to? We are just in the process of releasing a newly updated curriculum. Over the weekend, we're going to kind of finalize it up and release it to our members. It includes brand new teaching videos in English and French. It's best practice and evidence-based, with kind of that lens of good, better, best. Good is the legal minimum. We want to make sure that everyone is following the laws in their province or territory. Best being that best practice recommendation, and most caregivers fall somewhere in between. We have made sure that this new version is clear, user-friendly, and with useful tech integrations. So meaning like QR codes, links to other resources that that learners can access right from their manual, right from the slides in the training. We've tried to make it supportive of learners of various varied learning styles and backgrounds as well. We're starting at the beginning. This is a car seat. Let's start where we all know we can succeed from that point. We have measurable assessment of skills and knowledge throughout, and it's built in throughout now. So we used to have an exam. It was, you know, mildly terrifying for a lot of our members to take that exam, and now we've broken it up into smaller knowledge checks. We're not even calling them quizzes, because we want to make sure that everyone is aware that it's an assessment. And like, this is what you're expected to do. Expectations are super clear. And our instructors are finding it nicer, easier to teach, and more supportive of everyone's learning. We're also really focused on building confidence. So layering foundational hard skills, being like technical stuff, with those soft skills of, okay, a parent has talked to you about this. What are you going to say in response? Like, let's practice that, because that's what we did hear from the course evaluations that we've been doing over the years. Is we want to know what the script is. What's the banter? How do we talk to parents and caregivers in a way that's supportive and with empathy, and also factual, right? So how are we going to talk to caregivers? The feedback from our beta tests have been overwhelmingly positive, and we're just now moving into the full release in the spring. We're also working on expanding our online workshops. We have an ongoing evaluation of the effectiveness of these workshops. We know that in the last year and a half, is it a year and a half, Holly?
Yep.
We've had 1,000 participants who have participated and completed one of those online workshops, either for retailers or for those who drive transport children for social service organizations. So that's been a really wonderful way to expand this knowledge throughout Canada and meet our mission in a different and innovative way. There is a French language version that is that's coming. And we've also developed targeted versions for other audiences. Sorry, we're intending to prepare additional targeted versions for other audiences. So for example, for other existing retail partners, kind of their own program as well. Other advocacy avenues that we're in the process of exploring is advocating for the removal of taxi exemptions and rideshare exemptions in provinces and territories throughout Canada. We did just prepare a recent position statement on the subject. It's only 3 pages. It's pretty brief. It's a 1-page position statement, a 1-page of this is the table, and this is what the law looks like in each province and territory, and a list of references as well. You know, when we're talking about how can we improve injury outcomes, it's great that we're helping parents and caregivers who are already using car seats to use them safely and correctly, but we want to make sure that we're also addressing those folks who are not using a seatbelt, who aren't using a car seat, and may not know that they need to, and don't fully understand the risks when it comes to using a taxi or rideshare without a car seat or a seatbelt. So we want to advocate for that more. We know that members want more resources, so they want more parent-facing resources that they can share locally. In the past, it wasn't something we did, but we're working on that now, and that caregivers have responded well to those harmonized social media messages, images and messages that we've kind of shared collectively from both our voice as well as other agencies that are sharing those messages. And we do have a project in the work to support Safe Kids Week 2023 with Parachute Canada as well, that's going to be something that they're looking forward to and figuring out what exactly the messaging and the program is going to be, but that'll be a focus for our continued advocacy this year. I guess that's where we're at. And we made it within the 45-minute mark. We may have spoke a little fast, so, but thanks for bearing with us on that.
Nita, were there any questions for us?
Yeah, so the first one, looks like the first one was about sources of stats. Thank you, Catherine. Looks like you've already answered that question for me. The second
Most of the
one,
statistics in the beginning, yeah, they did come from the Decision Makers Guide, which was a resource that Child Safety Link developed for decision makers in Atlantic Canada, but that's where we kind of sourced the first few slides there. But if there's any questions about any of the other stats or kind of information, you can feel free to follow up as well.
the second question was if the presentation slides will be made available, or I guess if I can distribute it to this group.
Sure, absolutely.
Absolutely.
Is there a child passenger safety course for healthcare providers? There used to be one offered in BC, but no longer available.
Right. So when you say healthcare providers, are you able to elaborate? Like, who exactly are you looking for? I do work in a children's injury prevention center personally that is located in a hospital. And so we don't have anything nationally for nurses who are discharging infants for the first time. If that's what you're asking about, I do have something provincially. So I do have a 90-minute training and a policy to back it up, that every health center across Nova Scotia that discharges an infant for the first time is required to provide education and support to caregivers specifically about their car seat use. And we do have training that was written for that. By we, I don't mean CPSAC, but there is training that's written for that, a 90-minute in-person webinar, because that's the what they gave us as a way to deliver that, and also like an online learning management system module as well throughout Nova Scotia. So it's something that's being asked of CPSAC in the past. I know some other provinces have asked it, and we haven't gone down that route yet, but it's something that we'd be interested in working on, and that I feel that we do have the skills to do it. The reason I was hesitant to make something that was national is because so much of the education that I do locally specifically addresses the policy. So it kind of brings it back to the policy. Now, that's not to say that the education could come first and then it could be supported by a policy requiring it, but it's not something that we have done yet. If that's something you're interested in, reach out. You know, I think it's definitely something that we've wanted to collaborate on for a long time, but we'd need to bring some other people together from other areas of Canada too, to talk about how they do this work, what they do, and how we could best make that training or presentation. If it's about the safe transportation of children with special healthcare needs, there is that additional training that is 2 days. It's called Safe Travel for All Children. It's a US curriculum, but we're using the US seats. So that's what we're using. And there's 3 instructors for that program in Canada now, myself and 2 other OTs, one in New Brunswick and one in Nova Scotia. And that's something also that we could talk about if you want to talk about other resources that could be available for healthcare providers. Yeah. Any other questions?
Our next question is with regards to the cost of the course.
Holly, did you want to speak to that one?
Sure. So that varies across Canada, and we do have membership fees that need to be covered by the instructor. So sometimes this might be subsidized if they're working with an organization to have members trained, but the cost is set by the instructor to cover their fees. So that will vary, but typically we see prices anywhere from, I would say, about $80 through $300, depending on the region.
And that really just kind of speaks to what the infrastructure is across Canada in support of that. So like locally, my courses are like $80 because I'm really just charging for the membership fees. So the only thing that CPSAC gets and our primary funding is $50 for membership for 3 years. That provides people with access to webinars, access to networking, you know, direct support in a lot of ways. And also I should mention included insurance when people are working as a volunteer. So anyone who's doing this work and isn't being paid for their time is eligible for, is covered through the organization's insurance. And that was something that was really important to us. And honestly, most of our fees go towards the huge cost of insurance every year. It's up for renewal now, so I'm just hoping it doesn't go up too much. But yeah, we've kept the membership fees at $50 for as long as I have been for at least the last 8 years. So we try to keep that part relatively low, and all of the money goes back into the organization. It goes into us, you know, once a year presenting at a conference, and the insurance, and also providing support to members and you know, recognition and initiatives and things like that. So nobody's making any money. It's all going back into the organization. But each individual instructor is their own, you know, they all do this in different ways. And so some of them are being paid for their time and having their resources covered, and others are doing this as a volunteer on their evenings and weekends. They're taking vacation weeks from their regular day job because they're passionate about this work, or it's their, you know, side work. And so the cost does vary for the actual course across the country.
I will just also add that there are some instructors and organizations that offer scholarship spaces. So something that I do locally in the Vancouver area is making sure I have reserved spaces for Indigenous communities. Coming back to our goal to have culturally safe support, we want to make sure that we have people that are working inside communities so that they can access culturally safe support. So there are other programs at the instructor level as well for offering scholarships depending on where you're located.
Yeah, and I also wanted to say that the drivers program, so that online on-demand program for social service organizations, there's a cost to that. It says that it's, you know, $75 on the website. If someone just logged in, found it, and took that course, that's what it would cost. But we've priced it so that we could encourage people to take it in bulk. And so we have quite a low rate per person when someone's purchasing 300 seats for their social service organization. And we've also scaled it differently for a place such as the Yukon, for example, where they might not have that mass, but they are providing that they're integrating this into their province, or sorry, territory. And for everyone, then we want to make sure that that's really affordable for them, because our goal is to have everyone have that training. And so we're trying to incentivize people putting more people through the training. And I will say that, again, through some partnerships, that program, for example, is available at no cost in Atlantic Canada because of the partnership with Child Safety Link and what we've been able to kind of provide in kind to support that work. And so it just really does depend. Yeah. Oh, the other thing I wanted to mention was Holly and I were working on for 2023 ways to offer that drivers program at no cost to Indigenous organizations as well. And that's another commitment that we're making for 2023. Hasn't officially been announced yet, but we're working on what that will look like.
Great. I think there was a follow-up question with regards to cost. I don't know, I think you touched on this briefly, but if there's anything more you can expand, and that's if you have any suggestions for those who are interested in taking the course, but aren't able to afford the cost of the course.
Katherine?
Those who can afford the cost. Okay, of the course. So, you know, it's hard to say. Like, you know, I have funding because I'm an injury prevention program, and I'm using my injury prevention funding from the province of Nova Scotia to subsidize this training where I'm at. And so I'd look to your injury prevention organizations, many of whom are on the call, you know, to figure out how you want to spend that program whatever funding that your program has. I know that in some areas, not to speak for you, Jason, over there, but the Saskatchewan Prevention Institute is partnered with and is funded through Saskatchewan government insurance. And so it may be an opportunity to work with your local insurance companies, other local, we've seen lawyers' offices sponsor trainings in the past when they were injury prevention lawyers. We've seen sponsored courses through health units. We've also seen a lot of closed courses where someone has decided that our agency is going to take this course, and you'll never see them on the website because they've reached out privately and they just have a course for the government, oftentimes, or a car seat manufacturer or a social service agency where they'll do their own training and that's how they'll fund it. I will say that although everyone is trying to cover their costs, the cost does vary. Another way to keep the cost down is to offer a space. The cost of space rental is incredible at this time, and so that has been a good way to lower cost is to partner with someone like that has a fire station or CAA that has, like bays, ambulance bays are another like great place to do this work, through the months from November until March for sure. Having that indoor space is key. So you don't have to cancel because of extreme cold and risk to parents and families. We've also partnered with police units and other kind of policing agencies to lower the cost, to kind of share that responsibility. But when it comes to accessing funding, I would just kind of start looking around and seeing who else should be a stakeholder in this, who else cares about injury prevention or could see this as a value added to their customers, for example, when it comes to insurance or retailers. So that might be another kind of way. When you're talking about, I've pulled up the comments now to talk about economic barriers for families and programs they can tap into, or do they need more funding? They absolutely need more funding. When it comes to the economic barriers of car seats, I personally was able to see 20 families over the weekend as a part of an initiative that we were doing with my hospital. They were all families with one or more vulnerabilities, as kind of highlighted on their discharge from hospital for the first time with their newborns. And they all had a car seat for their newborn because they knew they needed one. Some were about to expire. There was definitely some safety concerns, but many of them didn't have car seats for their other children. Right. And so in Nova Scotia, I'm very fortunate. Anyone who qualifies for income assistance is provided with a car seat as a protected amount for, when they enter the program on income assistance. And that's true of PEI, and that's true of a few other kind of provinces and territories that I'm aware of. So that's one idea for how you can advocate for better funding for safe car seats in your province, because I know that's not true in Alberta and Manitoba. In having recent conversations with people from those provinces, we know that there's lowered tax on car seats in Ontario and some other provinces. That was an initiative that they were using to try to like lower the costs, but still taking that tax off of $100 car seat versus an $800 car seat, it's still not directly addressing who needs that support. And so there's definitely ways that we should be advocating for support for car seats and purchasing car seats and programs to provide car seats for families who we know are challenged in all of the ways that they are, right? This is just one more thing on a plate of a person who is, making sure that who may not have food or housing security. So I can absolutely share the discharge policies that I have in Nova Scotia. And I'll let Holly answer the other questions here while I go find. I'm going to go link you because I do have that.
I did just see a question come up about how to find a support or technician. And we have a wonderful tool on our website. So I'm just going to briefly share that with you here. So if you go to CPSAC.org, so CPSAC.org, you will find our Find a Technician tool. And it is, bear with me, there's all my Zoom stuff is on my screen here, but under Caregiver Resources, Find a Tech, you'll find our map of technicians across Canada. So you're able to zoom in on a particular area and then see who is available locally. So once you get in close enough, you'll see their contact information and how to book with them. So this is the tool that we have for locating technicians. Unfortunately, in Canada, we don't have the same setup as we have elsewhere in North America and the US. It is very common for people to seek help at a fire station. And that's because the way that their programming is set up, they do have a large number of law enforcement and first responders trained and programs through those fire halls. It's not the same in Canada per se. So while there could be a chance that someone is trained, it's just significantly less likely. And I think because of the internet and our culture sharing between the US and Canada, that suggestion just prevails. So we do find that if they want to find someone certified, this is the best way to go about it, is through our Find a Tech tool.
And I will also mention that these are the people who have volunteered to be publicly available so that anyone can search them, can find them, can write them directly. There's a lot of others who are doing this work, you know, who are occupational therapists at a hospital, who are doing this work, you know, privately for their own social service organization that would never be found here. So this is not representative of like who exists to help parents and families. This is just who has agreed to be publicly listed on the website in this way. And so if you are looking for resources in your own community, you can reach out to us and we can kind of network and figure out who has, who's already involved in this work and who wants to work better together. I will say also one of our main goals has been partnering better with all of the different voices at the table, all of the different people who are doing this work across Canada. You know, that's definitely, you know, I saw someone here from St. John Ambulance, you know, as a tag, not to call you out, but I'd love to like have a conversation about how our organizations could better work together to make sure that parents and caregivers have this information, you know, and what that looks like and how we can share resources. It's something that we've done in the past with the Infant Toddler Safety Association when they were still doing this work. We worked, you know, closely with them near the end, and there's a few other organizations as well that we've worked with closely in the past. And I feel like it's something where we're all in this together and we're all figuring out how to do this work better. And that's something that we've put out this year as well, is we've addressed it in our code of conduct, how to work with people who have different training, who have come from a different background, who come from a different experience, to do this work, because we're all in it together and we're all on to make sure that we're all on the same page and have the resources to do that.
So there is just one more question, also being cognizant of time. Is there an opportunity to advocate or work with organizations who are supporting newcomers to Canada?
Isn't that awesome? It's a great idea. In some areas people are, but again, it's something that you have to have on your radar, that you need to be aware of in this work. So I do it locally, you know, through the Children's Injury Prevention Center, through Child Safety Link. I've developed resources in 9, soon to be 15 languages that include videos. And, you know, I've definitely trained people whose specific catchment areas working with newcomers in support of newcomers. There's not like a national strategy that I'm aware of. If there's a provincial strategy that, you know, we could support or link into, that's definitely something that you know, is a passion of mine, you know, in specifically creating those resources. I will tell you that all of the photos in the new curriculum, you know, they are accurate photos of diverse families and diverse kids in affordable price point seats. Like, we're trying to make this as accessible as possible. We want everyone to see themselves in this work and to see themselves in this curriculum as well. And you know, and that was something that was really important to us, to make sure that these are not stock photos. These are photos of real kids in real car seats. And that's true of our videos and other resources as well.
Okay. So if there are any further questions, comments, or if you'd like to perhaps collaborate with CPSAC, Katherine and Holly's email addresses are on the screen. I'm sure they'd more than welcome any comments. And yes, I will, or could you share when these resources are available? was one
where
more
these
question.
resources. So this is a Child Safety Link resource, and that's the resources that were available in multiple languages, and that includes Ukrainian and Russian at this time, but we're also working on like Dari and Farsi, and that's a Child Safety Link project. But I recognize that languages are different across different regions too. So these were just based on my hospital's interpretation requests, like that's the languages that we chose. And so you may need different languages in your area, but this is a bit of a start to it. But when it comes to all of the rest of the information, it's cpsac.org, and that's where you can find training and other resources. Many of it is for members specifically, so people who've taken our training. But if this is something that you're interested in and that you want to see more of this training, if you want to know more about like what it looks like and what it is, please feel free to write us, at the email addresses below, or even just at info. We're happy to share kind of what we have and what we are to help, further this cause across Canada.
And Anita, I will share the presentation to you so you can share that out.
Great, will do. And I'll email it sometime this week, along with the recording of this presentation, if you're interested to revisit any of the content that Holly and Katherine had presented. And we do have a lot of thank you comments, appreciation, and it was a great presentation. So thank you for presenting with us today.
Thank you so much for having us.
Yeah, it was great to meet everyone and see everyone.